NCLEX RN Exam Questions PDF. Question 1. Set 1. At what age should a child be able to sit unsupported? For months, 6 months, 9 months, 12 months. Most infants can sit unsupported by 6 to 8 months. Question 2. Set 2. A patient is experiencing an acute manic episode. What is the priority? Involving them in group therapy, providing a high-calorie, finger food diet, teaching coping skills, encouraging social interaction. Manic patients have high energy and may not sit for meals. Finger foods provide necessary nutrition while on the move. Question 3. Set 3. What is the golden hour in newborn care? The first hour after birth for skin-to-skin and bonding, the first hour of active labor, the first hour of the second stage, the hour before discharge. The first hour after birth is critical for bonding and initiating breastfeeding. Question 4. Set 4. What does alopecia mean? Loss of appetite, loss of hair, loss of hearing, loss of skin pigmentation. Alopecia is the medical term for hair loss. Question 5. Set 5. A patient with type 1 diabetes is shaky and sweaty. What should the nurse do first? Administer insulin, check the blood glucose level, give 15 g of simple carbohydrates, notify the provider. Assessment of blood glucose is the first step when hypoglycemia is suspected. Question 6. Set 6. What is a major safety risk for toddlers? Sports injuries, poisoning and drowning, occupational hazards, elder abuse. Toddlers are at high risk for accidental poisoning and drowning due to their curiosity and mobility. Question 7. Set 7. Which is a characteristic of croup? Productive cough, barking, seal-like cough, wheezing on expiration, high fever. Croup is characterized by a distinctive barking cough caused by laryngeal edema. Question 8. Set 8. What is the primary goal of care for a patient with Alzheimer's disease? Curing the disease, maintaining safety and function, improving memory, teaching new skills. Management focuses on safety, nutrition, and maintaining the highest level of function possible. Question 9. Set 9. What is the priority intervention for a patient experiencing chest pain? Administer morphine, obtain a 12-lead EKG, check blood pressure, call the family. A 12-lead EKG is the priority to determine the cause of chest pain, ischemia versus me. Question 10. Set 10. A client is diagnosed with peripheral arterial disease, PAD. Which symptom should the nurse expect? Dependent rubor, painless ulcers, bilateral edema, warm skin. Dependent rubor, redness when legs are down, is a common sign of PAD. Question 11. Set 11. A nurse is caring for a patient with atrial fibrillation. What is the primary risk for this patient? Heart failure, thromboembolism and stroke, ventricular tachycardia, hypotension. Stasis of blood in the atria can lead to clot formation and subsequent stroke. Question 12. Set 12. What is the diet recommended for a patient with diverticulitis in the acute phase? High fiber, NPO or clear liquids, high fat, low protein. During acute diverticulitis, bowel rest, NPO or clear liquids, is necessary to allow inflammation to subside. Question 13. Set 13. A patient with cirrhosis has an elevated ammonia level. Which medication should the nurse expect to administer? Lactulose, furosemide, spironolactone, propranolol. Lactulose promotes the excretion of ammonia through the stool. Question 14. Set 14. A patient with heart failure is prescribed digoxin. Which finding should the nurse report immediately? Heart rate of 72 bpm, visual disturbances like seeing yellow halos, increased urine output, blood pressure of 120/80 mmHg. Yellow halos are a classic sign of digoxin toxicity. Question 15. Set 15. A patient has a suspected fracture. What is the first priority? Administer pain medication, immobilize the limb, apply ice, obtain an X-ray. Immobilization prevents further tissue damage and reduces pain. Question 16. Set 16, HbA1c levels reflect glucose control over what period? 24 hours, 1 week, 3 months, 1 year. HbA1c measures the percentage of glycated hemoglobin over the 120-day lifespan of red blood cells. Question 17. Set 17, what is a classic sign of appendicitis? Left upper quadrant pain, rebound tenderness at McBurney's point, pain relieved by eating, hematmesis. Pain in the right lower quadrant with rebound tenderness, McBurney's point, is classic for appendicitis. Question 18. Set 18, which sign indicates a potential complication of a thyroidectomy? Sore throat, laryngeal stridor, fatigue, dry skin. Stridor indicates airway obstruction, possibly from edema or nerve damage post-thyroidectomy. Question 19. Set 19, a patient is scheduled for surgery. When should the consent be signed? In the OR, after the sedative is given, before any preoperative medications are administered, in the recovery room. Consent must be signed while the patient is alert and not under the influence of mind-altering drugs. Question 20. Set 20, which position is best for a patient receiving a tube feeding? Prone, supine, high Fowler's, left lateral. High Fowler's position prevents aspiration during enteral feeding,